Hello, my name is Wendy Gramajo, and I will be presenting my clinical assignment on voyeuristic disorder. General description of the disorder. The diagnostic criteria for the disorder can apply both to individuals who more or less freely disclose this paraphilic interest and to those who deny any sexual arousal from observing an unsuspecting person who is naked, disrobing, or engages in sexual activity. If disclosing individuals also report distress or psychological problems because of their voyeuristic sexual preferences, they could be diagnosed with voyeuristic disorder. On the other hand, if they declare no distress demonstrated by lack of anxiety, obsessions, guilt, or shame about these paraphilic impulses and are not impaired in any other important areas of functioning because of this sexual interest, and their psychiatric or legal histories indicate that they do not act on it, they could be ascertained as having voyeuristic characteristics, interests, but should not be diagnosed with voyeuristic disorder. Some people with the disorder are unable to have normal sexual relations. Others, however, have a normal sex life apart from their disorder. Diagnostic criteria and symptoms. A. Over a period of at least 6 months, a person with voyeuristic disorder experiences recurrent and intense sexual arousal from observing the unsuspecting individual who is naked, disrobing, or engaging in sexual activity. As with other paraphilic disorders, this arousal takes the form of fantasies, urges, or behaviors. This disorder usually begins before the age of 15 and tends to persist. B. The individual has acted on these sexual urges with a non-consenting person, or the sexual urges or fantasies cause clinically significant distress or impairment in social, occupational, or other areas of functioning. C. The individual experiencing the arousal and/or acting on the urges is at least 18 years of age. Diagnostic criteria and symptoms continued. You must specify if, in a controlled environment, primarily applicable to individuals living in institutional or other settings where opportunities to engage in voyeuristic behavior are restricted. In full remission, the individual lies not acted on the urges with a non-consenting person, and there has been no distress or impairment in social, occupational, or other areas of functioning for at least 5 years while in an uncontrolled environment. Diagnosis features. Recurrent voyeuristic behaviors constitute sufficient support for voyeurism by fulfilling criteria A and simultaneously demonstrate that this paraphilially motivated behavior causing harm to others by fulfilling criteria B. Adolescence and puberty generally increase sexual curiosity and activity. To alleviate the risk of pathologizing normative sexual interest and behavior during pubertal and adolescence, the minimum age for this diagnosis of voyeuristic disorder is 18 years. Criteria C. Criteria A timeframe, indicating that signs or symptoms of voyeurism must have persisted for at least 6 months, should also be understood as a general guideline, not a strict threshold, to ensure that the sexual interest in secretly watching unsuspecting naked or sexually active others is not merely transient. Prevalence rates. Voyeuristic acts are the most common of potentially law-breaking sexual behaviors. The population prevalence of voyeuristic disorder is unknown. However, based on voyeuristic sexual acts in non-clinical samples, the highest possible lifetime prevalence for voyeuristic disorder is approximately 12% in males and 4% in females. Differential diagnosis: conduct disorder and antisocial personality disorder. Conduct disorder in adolescents and antisocial personality disorder would be characterized by additional norm-breaking and antisocial behaviors. Unsuspecting others who are naked or engaging in sexual activity should be lacking. Substance use disorders. Substance use disorders might involve single voyeuristic episodes by intoxicated individuals but should not involve the typical sexual interest in secretly watching unsuspecting persons being naked or engaging in sexual activity. Hence, Recurrent voyeuristic sexual fantasies, urges, or behaviors that occur also when the individual is not intoxicated suggest that voyeuristic disorder might be present. Common treatment approaches. A range of treatments have been tried, including aversion therapy, which is a form of psychological treatment in which the patient is exposed to stimulus while simultaneously being subjected to some form of discomfort. Masturbatory satiation, behavioral treatment method where client masturbates with a deviant fantasy in mind. When the client reaches orgasm, they must continue to masturbate to the deviant fantasy for 1 hour. Since this activity does not end in reinforcing ejaculation, the client may eventually lose interest in such fantasies. Orgasmic reorientation. It teaches individuals to respond to more appropriate sources of sexual stimulation. And relapse prevention training. Lady Godiva and Peeping Tom. According to legend, Lady Godiva rode naked through the streets of Coventry, England, in order to persuade her husband to stop taxing the city's poor. Although all townspeople were ordered to stay inside their homes with shutters drawn during her 11th century ride, a tailor named Tom could not contain his sexual curiosity and drilled a hole in his shutter in order to watch Lady Godiva pass by. Since then, the term "peeping Tom" has been used to refer to people with voyeurism. And this concludes the end of my presentation on voyeuristic disorder. Thank you.